Good afternoon, everyone. I grew up listening to a song which actually was one of my favorites. This was made probably in 1961 or maybe even 1 year earlier in 1960. The song was in a Hindi film and the music was composed by Usha Khanna. The lyrics were written by Prem Dhawan and it was sung by Mukesh. The song goes like this: छोड़ो कल की बातें, कल की बात पुरानी, नए दौर में लिखेंगे मिलकर नई कहानी, हम हिंदुस्तानी, हम हिंदुस्तानी, हम हिंदुस्तानी। आओ मेहनत को अपना ईमान बनाएं, अपने हाथों अपना भगवान बनाएं। राम की इस धरती को, गौतम की भूमि को सपनों से भी प्यारा, सपनों से भी प्यारा हम हिंदुस्तान बनाएं। Now the lyrics are quite simple, in fact too simple for comfort, and I fear that many contemporary Indians would not understand the message. The message then and now is very clear that do not ponder over the past, do not focus only on the past. Look ahead and make sure that you do not divide or get subdivided or even subdivided to such an extent that even an electron microscope cannot identify you as an Indian. Now, I don't want to lecture you any further. The message is simple because times now are quite turbulent. We have this batshit crazy American president, and we cannot afford to be collateral damage in the times which would be coming very soon. Now on to something equally serious, and that is on a new drug which is called Orforglipron. Orforglipron has let me tell you something about it. This is an oral Ozempic. Yes, look at it as an oral Ozempic. This is a GLP agonist, which means that it reduces weight, and along with that, it also reduces blood sugar. Now we have this open labeled randomized study published yesterday in The Lancet. This had 962 patients of diabetes. The mean age was around 56 years. 50% were women. The glycated hemoglobin, which is a reflection of the average glucose in the previous 3 months, was 8.1%. By and large, these patients were having diabetes for the last 8 years. They were randomized to essentially 4 groups. In 3 groups, this new drug was used, Orforglipron, and in the control group, dapagliflozin was used. Dapagliflozin is an SGLT2 inhibitor, which is freely available in India. It is quite cheap, and I use it in almost all patients of heart failure and also diabetes. The reason is that this class of medication, that is an SGLT2 inhibitor, not only protects the heart, treats heart failure quite effectively, but also protects the kidney from further damage. Now we come back to Orforglipron. Orforglipron is a GLP agonist, which means that this kicks the release of insulin, reduces the release of glucagon, and reduces appetite, and that is why it is being used as a weight-reducing agent extensively now across the world. Orforglipron has the advantage of being a tablet. It is a small molecule tablet, and the advantages are that it requires no refrigeration, and also it has no connection with food or water. You can have it whenever you want. Now back to the study. The study was done for about 40 weeks, that is 10 months, and the results were that orforglipron was non-inferior and in fact superior to dapagliflozin, which was used as a 10 milligram tablet in these patients, whereas orfo was used in 3 doses, a 3 milligram tablet, a 12 milligram tablet, and a 36 milligram tablet. And what was found was that every dose of orforglipron was superior to dapagliflozin in the reduction of glycated hemoglobin. This was reduced by almost 1.6% in the orfo group, as opposed to about 0.8% in the dapagliflozin group. Apart from this, the 12 milligram and 36 milligram tablets of orfo were also superior in reducing triglycerides, non-HDL cholesterol, and body weight, and also blood pressure. Systolic blood pressure was reduced by around 5 milligram, and the weight was reduced by about 7% in a mere 10 months, and the trigs were reduced by about 7 to 14%, and the non-HDL cholesterol was reduced by around 5 to 6%. Now, these numbers are of course relative and really do not signify anything significant clinically. But the authors conclude, and we must bear in mind that this was a company-sponsored and a company-funded study, and the authors conclude that the drug was more effective than dapagliflozin in reducing the glycated hemoglobin, in reducing blood pressure, triglycerides, non-HDL cholesterol, and also the body weight. The problem, however, is that we have a series of serious adverse effects with this drug. I have written quite a long time back on the serious adverse effects with Ozempic, and these are in my Substacks. However, we come back to the study, and here we have that in these 720 patients who received orforglipron, 2 patients developed cholelithiasis, which means gallstones and inflammation of the gallbladder. There were 4 patients who had a disorder in the biliary tract system. There were 4 patients who had a major adverse cardiovascular event, and even more concerning, there were 2 patients who developed pancreatitis, which can be a serious problem. And above all, what concerns me the most is that 20% of the participants who were given orforglipron discontinued the drug because of these side effects, and in fact more than 50% of the patients given orforglipron had gastrointestinal adverse effects such as nausea, vomiting, diarrhea, and constipation. But what is worrying is that 20% of the patients in the new drug were forced to stop the medication and discontinue the drug because of adverse problems. Now, this is a concerning matter because diabetes is a long-term disease. It is a chronic disease, and you expect a patient with diabetes to carry on with his or her medication for the next so many years. And also, the moment you stop these GLP agonists, your weight creeps up. So therefore, how do you continue with this medicine when this latest study published yesterday tells us that 20%, as many as 20% had to discontinue? So therefore, in the end, I leave it to you to decide whether you would like to use such a drug to reduce your weight or to reduce your blood sugar. Of course, the advantages are this is a tablet, this is not an injection, it does not require a fridge, and it can be taken any time of the day. It has no connection with water or meals. But on the flip side, the problem is that we have these adverse effects, and we must remember that the study was funded by a drug company making this medicine, and yet we have quite a few participants having serious adverse effects. So the choice will be yours. The side effects will, of course, be minimized by the company and by the authors of this paper. And so far, I have not come across a news note on this study, which was published yesterday. Thank you very much.